What is a stroke? Stroke is an acute neurological injury or a brain dysfunction due to vascular pathology. That means it affects the blood vessels and it manifests as infarction or hemorrhage. What are the major causes of stroke? It can be age. It can be gender male. Hypertension, smoking, diabetes mellitus, atrial fibrillation, heart disease like rheumatic heart disease, infective endocarditis, atrial fibrillation, etc., and dyslipidemia, alcohol, coagulopathy, contraceptive pills, and a lot more. Then comes the clinical classification of stroke. It can be completed stroke, evolving stroke, transient ischemic attack, reversible ischemic neurological deficit. Let's look into it. Now, what is a completed stroke? Completed stroke has rapid onset and the neurological deficit will be persistent. It won't progress. Then comes evolving stroke. Evolving stroke has a stepwise development of neurological deficit. It will progress. Then comes a transient ischemic attack, the focal neurological deficit which gets resolved in 24 hours. That's a transient ischemic attack or TIA. Then reversible ischemic neurological deficit. That's a neurological deficit resolves in 1 to 3 weeks. Move on to causes of young stroke. That is people below 40 years. In infants and children, why stroke occurs? It is because of some congenital heart diseases, arterivenous malformations, and thrombosis of veins. Why in children and young adults? In these people, we can see cardiovascular diseases like rheumatic heart disease, infective endocarditis, embolism, mitral valve prolapse, etc. Another important disease is arteritis. It can be due to TB, syphilis, myoma disease, and Takeuchi arteritis. Some collagen vascular diseases like SLE, antiphospholipid syndrome, etc., and some inborn errors of metabolism. We know that homocystinuria, Fabry angiokeratosis, like things causes stroke. Thrombophila. It can be due to activated protein C resistant syndrome or protein CS deficiency, antithrombin 3 deficiency, etc. Some acquired conditions like cancer, pregnancy, oral contraceptive pills, hormone replacement therapy, antiphospholipid syndrome, high level factor 8, heparin induced thrombocytopenia also causes young stroke. Thank you and subscribe for more.